Hi, I Dr. Chava Anjaneyulu, Chairman for Asian ENT Care Center, located in Panjagutta, Hyderabad. Adenoid and tonsil problems are common problems. Nowadays, many children they are suffering with the adenoid problem. Previously, the common problem is the tonsil problem. Nowadays, the common problem is adenoid problem. Mainly because the pollution is increased in the urban areas and some rural areas also. So in urban areas, many children after 3 years, they are suffering with severe nasal obstruction, nasal discharge, mouth breathing, snoring, sleep disturbance. Mainly they are suffering with the recurrent infections of the nose. This mainly because due to increased pollution in the atmosphere, increased viral infections, and less physical activity and less ventilation in the homes. And more crowding, because nowadays in urban area, many people are staying in apartments, there are many apartments. So infection will transmit from one person to another person. In children, especially 3 to 4 years age, they will not exposed to all virus, so they have less immunity, so there is a more chance of getting infection. Nowadays new viruses are coming, new strains are coming, that is causing problem both children and parents in the same home. So now many people they are saying either parents or children are suffering first, then the other people are getting. Once both they get treated, maybe within 1 week or 10 days they are getting back again, especially children. So these recurrent infections in children and suffering are increasing. Many children they are not having proper sleep in the night, they are lacking attention in the sports, education, and more leaves because of fever, nasal obstruction, they are not attending the schools. This is basically because of the adenoid hypertrophy. Because adenoid is the primary location where this pollutants virus first attack, that will increase the size of the adenoid. Increased adenoid size or enlarged adenoids will further predispose to the more viral infections and more pollutants effects. So this is vice versa. Pollutants and virus part increase the size of adenoid. Adenoid size, if it is more, there is a more chance of viral infection and pollutant effects. So children nowadays they are suffering a lot with adenoid hypertrophy and recurrent adenoid infections. Usually we can diagnose this adenoid hypertrophy by the X-ray and nasal endoscopic evaluation. Nasal endoscopic evaluation is more accurate. We can see the lumen size, choana size also while evaluating the adenoid size. So if that closes the choana, it is very difficult for the patient to get breathing. So depending on the size of the adenoid, duration of the problem, we have to tailor the treatment for the children. If the child is having few days history of problem, nasal obstruction, recurrent cold, we can try with medicines and we improve the child physical activity and we increase their health by increasing physical activity and ventilation to their bedrooms. So we reduce the pollution effect on their nose, we reduce the viral infection load on the nose, and we improve the resistance by improving physical activity, and we advise them to take steam inhalation. So most of the children will recover. If they don't get relief in 6 weeks to 2 months or 3 months, it is better to operate. And if the child is also having problem for more than 6 months to 1 year, it is better to operate. Many parents they think Adenoid is a immunity organ. It will provide the immunity to the children. But damaged or infected enlarged adenoid will harm more than the benefit. So there is no side effects, no complications. If you remove the adenoid, child immunity will not get affected. So if the child is having adenoid hypertrophy along with the recurrent cold attacks, it is better to remove adenoid. Very simple procedure. Patient can be discharged same day, no blood loss. Very effective procedure, and the child becomes healthy both mentally and physically. If your child is having adenoid or tonsil problem, contact Asian ENT Care Center located in Panjagutta, Hyderabad.